Thyroid function panel is used to evaluate thyroid gland function effectively. It measures level of thyroid hormones to assess how well the thyroid is working. It can aid in diagnosing thyroid disorders accurately, so it can help detect conditions such as hypothyroidism, hyperthyroidism, and thyroiditis. It can monitor thyroid hormone therapy precisely. It can help ensure that patients are receiving treatment for thyroid disorders, maintain appropriate hormone levels. This uses serum samples to measure thyroid-related hormones and antibodies. It provides a comprehensive analysis of thyroid status for diagnosis and treatment monitoring. An analyte in the thyroid function panel is your TSH, or your thyroid stimulating hormone. This is produced by the pituitary gland to regulate thyroid hormone production. Primary screening test for the thyroid function as well. Free thyroxine, or free T4, is the unbound active form of thyroxine hormone, and it reflects thyroid hormone production. Free triiodothyroid, or free T3, is the active form of the hormone. It's important for metabolic activity, often measured in hyperthyroidism. Total thyroxine, or total T4, measures both bound and unbound thyroxine in the blood. Total T3 measures both bound and unbound. Thyroid peroxidase antibody detects antibodies against thyroid peroxidase enzyme elevated in autoimmune thyroid diseases like Hashimoto's thyroiditis. Thyroglobulin antibody detects antibodies against thyroglobulin protein, which is also elevated in autoimmune thyroid conditions. If you have an elevated TSH and low free T4, this combination typically indicates hypothyroidism, meaning the thyroid gland is underactive in producing insufficient thyroid hormones. The pituitary gland increases TSH secretion to stimulate the thyroid to produce more hormones. Some common causes include Hashimoto's thyroiditis, iodine deficiency, or thyroidectomy. A low TSH and a high free T4 and free T3 suggest hyperthyroidism, where the thyroid is overactive in producing excessive thyroid hormones. The pituitary gland reduces TSH production in response to high circulating thyroid hormones. This is common in Graves' disease, toxic multinodular goiter, or thyroiditis. Some isolated TSH abnormalities. So sometimes only TSH levels are abnormal while free T4 and free T3 remain normal. This may indicate subclinical thyroid disease. So early thyroid dysfunction that may not yet present with symptoms but could progress. Patients may need monitoring or further evaluation. Some additional tests for autoimmune thyroid conditions. So thyroid antibody test, thyroid peroxidase antibody, thyroglobulin antibody can help diagnose autoimmune thyroid diseases like Hashimoto's thyroiditis and Graves' disease. These tests support the diagnosis when thyroid function tests are abnormal or clinical suspicion is high.